How do Botox injections work for OAB? Imagine a treatment that can help calm an overactive bladder and give you more control over your daily life. That's what Botox injections aim to do for people with overactive bladder. When someone has this condition, their bladder muscles contract involuntarily, causing urgency, frequent trips to the bathroom, and sometimes leakage. Botox, which is a purified form of a protein called botulinum toxin type A, can help reduce these symptoms. The way Botox works is by targeting the nerves that tell the bladder muscles to contract. Normally, when your bladder fills, nerves releases a chemical called acetylcholine. This chemical binds to receptors on the bladder's muscle wall, called the detrusor muscle, prompting it to contract. In overactive bladder, these contractions happen too often or involuntarily, leading to discomfort and accidents. Botox blocks the releases of acetylcholine from nerve endings, which means the signals telling the bladder to contract are diminished. As a result, the bladder relaxes more easily and can hold urine longer, reducing the urgency and frequency of urges to urinate. But Botox doesn't just affect motor nerves that control muscle movement. It also acts on sensory nerves in the bladder wall. These nerves send signals about bladder fullness and discomfort. Botox reduces the releases of other chemicals like substance P and calcitonin gene-related peptide, which are involved in transmitting sensations of urgency and pain. This helps lessen the sensation of needing to go suddenly, making it easier to hold urine and feel more comfortable. In addition, Botox may help modify abnormal reflex pathways between the bladder and the spinal cord that contribute to overactive bladder symptoms. This means it can help restore more normal bladder function by calming down overactive nerve signals. The effects of Botox are not permanent. Usually they last between 6 and 9 months. Over time, nerve endings regenerate and muscle activity gradually returns. Because of this, many patients opt for repeat injections to maintain symptom relief. The procedure involves inserting a small camera called a cystoscope into the bladder through the urethra and injecting small amounts of Botox into the detrusor muscle. It's a quick, minimally invasive procedure that is generally well tolerated. Botox injections are typically considered when lifestyle changes and oral medications haven't provided enough relief. They offer a way to improve quality of life by reducing the need for frequent bathroom visits, urgency, and leakage without the need for surgery. It's important to remember that Botox is not used to treat bladder cancer itself but can be safely used to manage symptoms if cancer has been ruled out or treated. In summary, Botox works for overactive bladder by blocking nerve signals that cause the bladder muscles to contract involuntarily. It also reduces nerve signals related to bladder sensation, helping patients feel less urgency and control leakage episodes better. The treatment is reversible, minimally invasive, and can be an effective option for those with symptoms that do not respond to other therapies. Always consult a healthcare professional to see if Botox is right for you and to discuss personalized treatment options.